launch of the Kenya Malaria Strategy. This year, the World Malaria Day is quite special in that we are not just celebrating the day, but also we are launching a strategy that will guide our investment in malaria. And mark the words, our investment, all of us, national government, county government, partners, everyone. Our investment in malaria for the next 5 years, from 2019 to 2023. Because the fight against malaria in this country has actually worked very, very well. This belt had a prevalence of 38% in 2010, but now it is less than 27%. Our incidence in 2016 was 63 per 1,000 persons, 63 cases per 1,000, but now we are talking of 42. Kenya is the so-called, is one of those countries that are called endemic countries, and malaria is a public health problem to us. As much as we are seeing the gains we have made, the gains are very, very fragile. They need to be, guarded 5 years. So historically, this is not our first time to come up with a strategy. I think in 1994, we had a malaria control plan. 1994, we had that. Later on, we became more strategic and developed a strategy 2001 to 2010 that really guided the investment in malaria in this country. And before it ended, in 2009, a malaria performance, program performance review was done in 2009, and with that, a new strategy was born, 2010, that was running through to 2017. And as we became more, sharper and more focused, midterm review came in, and in 2014, midterm review of this strategy was done, because during that period, we also had the devolution coming in, the new Constitution of Kenya, 2010 coming in. So, to have these things inbuilt into the strategy, a midterm review was done, and it gave us this document that just expired last year, the Kenya Malaria Strategy 2009 to 2018. Now, when a strategy ends, you have to document the lessons you have learned from that. We documented that process extremely well, and that is what led us to the development of this new strategy. Yes, what was the process of this? We started with a malaria program review, a performance program review, and this one goes through very classical approaches. Number one is phase one. Phase one is like a planning phase. The next thing is thematic desk review. The fight against malaria follows some thematic areas. And then we ended up the next month in July last year to do now consolidation of all that. And you don't get satisfied with that. You ask for external review. WHO was kind enough to do external review of our desk review, and they added even the field visit. Then we even created a scientific conference we call Kenya Malaria Forum, where we wanted to borrow a few scientific items that would come up from such a forum to enrich our strategy. The malaria program review report was done, and that report now was used to develop in the phase 4, the Kenya Malaria Strategy. The vision of this country when it comes to fighting malaria is a malaria-free Kenya. With that, our mission, we want to direct and coordinate efforts towards a malaria-free Kenya through effective partnerships. Our ultimate goal is to reduce malaria causes two things, either the sickness or death. And therefore, we want to reduce both by 75% of the 2016 level objectives. Our objective number one would be to prevent. Here they call it protect, to make it simple. To protect 100% of people living in malaria risk areas through access to appropriate malaria preventive intervention. And prevention in malaria is distribution of early lines, it is indoor residual spraying, it is labor source management, it is updating and documenting malaria vector control, preventing malaria in pregnancy, and use of community health volunteers to identify any missed opportunities. In a nutshell, our Kenya malaria treatment guideline is simple but needs to be implemented. It is to test, to treat, and track. So I'm glad to announce that over 90% of our health facilities are able to diagnose. We have put a very new objective in our Kenya malaria strategy this time round. That is, we want to be bold and do what is called subnational elimination. We want to establish structures, develop capacity for malaria elimination, and do active and passive case detection. And we want to do them in 4 counties. We are going to do elimination in Kirinyaga, Nyeri, Laikipia, and Nyandarua, okay? So 4 counties. Then we also want to invest a lot in malaria surveillance. The WHO has guided us that surveillance should be a core intervention. Then provide the overall leadership. You may not need this a lot, but it is one of our big objectives to provide leadership. As we do all these things, we must make sure that human rights, gender and equity is talked to as you program. Our other guiding principles are multi-sector approach. It should belong to all of us. We need to strengthen malaria performance and monitoring system. That's the only way we can make informed decisions. We need to strengthen the linkage between national and county governments. We are securing one country, but we need to invest in the health systems. Let us have a robust health system to realize our dream. But if the communities don't use our services, those services will not make any meaningful impact. So community health services needs to be leveraged. And I want us to put our hands together for Siaya County. His Excellency the Governor, it is the first county to put the community health volunteers fully in the payroll. Please clap for our. And now some counties are following suit, and I urge all other counties to recognize community level services. They are very, very important. Risk management of all sorts, financial risk and all those risks, resistance and all that need to be guarded very, very quickly. We need to sustain the finances to the fight against malaria. As I told you, the gains in malaria are usually very, very fragile. For the 5 years, we require 61 billion Kenyan shillings. The better part of this will be spent in preventive. You can see 67%. Prevention is very expensive, but at the end of the day, I think it's cheaper to prevent. Wow. So if we invest in case management, vector control, malaria prevention, advocacy, elimination, surveillance, and operational research, and have a farm program management, that is the kind of smooth road that will go to a malaria-free Kenya. Thank you all. God bless you.
It's a pleasure to be here today as we commemorate another World Malaria Day for 2019 and renew our commitments towards achieving a malaria-free Kenya. The occasion marks yet another milestone in the fight against malaria in Kenya, as we share progress that's been made, as well as embrace the new malaria strategy that has been launched this morning. RB, as a company focused on healthier lives for people, believes that it's our part and our mandate to be actively involved in promoting the achievement of health-related goals in Kenya. We remain committed towards this through educational initiatives as well as product solutions that are geared towards the prevention of illness. Our strategic collaboration with the Ministry of Health over the past 10 years and implementation of initiatives around World Malaria Day is a demonstration of our commitment, which we will continue. We've achieved a commendable reduction in malaria incidents over the years. However, that said, a lot still needs to be done to ensure delivery of quality health services and prevention of malaria towards our vision of a malaria-free Kenya, starting with the 75% reduction in incidence and death by 2023. At a community level, we focus and target towards the most vulnerable members of society. At a national level, we pledge to continue public awareness education campaigns about malaria and prevention through broadcast media. In support of the goal to achieve a malaria-free Kenya, we've also invested in development of products, so a variety of Mortein products which are designed to kill malaria mosquitoes instantly, as well as reducing the chances of contracting malaria. I'm encouraged that individuals in Kenya will also make a personal commitment to saving millions of lives and helping communities and economies thrive by embracing, the fact that zero malaria starts with me theme. Let us all maintain that spirit in rallying behind this year's slogan of Natumia Mbinu Zilizopitishwa Kumaliza Malaria. Thank you.
I'm overjoyed to be with you here on World Malaria Day, because the fight is here, because I can see everyone here who is fighting with us in the US government against malaria. We feel very welcome here, and we thank you for your kind hospitality. You all are here because you already know that malaria is a leading cause of illness and death here in Kenya. 70% of Kenya's population is at risk from malaria. But we can change that. And we made sure, working with our partners, that this malaria strategy contains targeted, smart, evidence-based investments. So together, we can have the greatest impact on the people who need it most. Through the President's Malaria Initiative, we are investing 3.5 billion Kenyan shillings on the fight against malaria. We share a vision with the people of Kenya, a vision where no person in Kenya dies from malaria, where clinics have the malaria tests and medication and prevention methods they need to save lives, where there are enough trained health workers and medical staff to properly diagnose and treat each and every person affected by this disease, working for them. So in partnership with the government of Kenya, we know that our investments are most successful when they're coupled with strong commitments from other governments and other partners, including the private sector. And we have to measure our successes and our failures with real data, using science so that we know how we can do better tomorrow than we did today, and how we can do better the next day after tomorrow. And that's why we have focused on a monitoring and evaluation plan to make sure this strategy is working over the next 5 years. As a middle-income country, it's important that Kenya's health strategy is ultimately self-sustaining. I want to promise you, the vision of a malaria-free Kenya is achievable. Did you know there used to be malaria in the United States? In Washington, D.C., the capital of my country, built on a swamp, there used to be malaria. but not anymore. There is no reason Kenya cannot achieve the same. So I call on all of you today, no matter what your job is, no matter what you do, to join in this fight against malaria. Eliminating malaria will not only free up the resources that we're spending to fight this disease, but it will improve the lives of men and women and children who are currently affected by this disease. We can help them. Together, we can create a future where no Kenyan has to die or suffer because of malaria, and Kenya can achieve its vision of a prosperous, strong, and thriving nation. Let's do it together. Thank you very much. Asante sana.
I am privileged to be here today on behalf of UNICEF, WHO, and the rest of the UN families in order to celebrate the collaboration with the Ministry of Health, with the counties, in the successful implementation of different malaria eradication and malaria prevention, diagnosis and treatment interventions, including the previous malaria strategy, the malaria program review of that strategy, and then the development and today the launching of the new malaria strategy. I'm happy to note that the new malaria strategy is very well aligned with the global priorities and with the 2015 call of the World Health Assembly to scale up malaria responses and move forward towards elimination. And it has endorsed the very bold vision of malaria-free Kenya, which is commendable. Kenya is really at the forefront of harnessing new innovations in malaria control. It is in the lifetime of this current strategies that we are launching that Kenya will pilot the implementation in select counties of the new malaria vaccine. This is happening already this year, as we know. And UNICEF, WHO, and all other leading partners recognize the public health potential of this vaccine to prevent malaria and to improve child health and save lives. And direction on the use of the vaccine in Kenya and beyond, all over sub-Saharan Africa and in other countries as well. We urge the government and the counties to invest as well into such innovations and into expanding research. The better we understand the parasites and the vectors in the Kenyan context, the more effective we will be in our response. And lastly, before completing, I would like to take this opportunity also to appeal all of us to elevate the national malaria program interventions from a single disease approach to a health in all approach, which is part and parcel of universal health coverage, which is part and parcel of our contribution to this. I wish we can all join hands to expand the malaria interventions as an entry point for strengthening the health system, including the overall maternal and child health programs and laboratory services and surveillance system to build a stronger system of health here in Kenya, including the health information system and the disease and entomological surveillance system. And we are committed to continue working with you all to ensure the successful implementation of the Kenya malaria strategy between 2019 and 2023. Thank you very much for your attention.
This is a very important program. In fact, it's true that malaria is a health burden, not only to Sierra, but also the entire country and the entire world. It is possible to have a free malaria Kenya, and I long for that day when malaria is no longer a challenge to us and to our people. It is possible. This strategy, I listened to Daktari when he was taking us through. It is a very good strategy, detailed. What has been really lacking and where the gaps have been is that the government has done a lot in the past, but information is not reaching the rural person. So this is where this strategy needs to focus on, to target the rural person, take information to them so that they are able to prevent themselves from attacks from malaria. The Ngao fraternity is ready to work together with the Ministry of Health to ensure that we eradicate malaria in this county and also other parts of this country.
I'm very excited to be here today to be part of this very important occasion of malaria celebrations and especially the launch of the strategy. I'm so excited in the manner in which the program head actually presented the strategy, and I am looking forward to the same implementation of that strategy with the energy that you're having, Daktari. Thank you so much. I have also made observations of the number of partners that have actually assisted us in the National Malaria Program activities. And as I was taking note of them, there are actually over 20. I really want to appreciate. No wonder then Dr. Wako has the passion of putting up a very ambitious strategy, and I want to believe that together we shall be able to achieve. Allow me to also note that statistics don't lie. The reduction is 11%. Right now, we are all excited about Kenya free of malaria. That means the remaining 27 has to be accomplished within the ambitious strategy. I realize that all of us have to double, more than double what you did in the last to be able to reduce malaria by 11%. Meaning, for our head of commission, Kenya, thank you so much for the 3.5 billion. We'll be looking forward to 7 billion. Can you clap for him? Because that is really what it means. And therefore, I want to challenge all our development partners, all the implementing partners, that the efforts you made for us to come down with 11%, you are going to more than double it so that we can be able to actually realize our dream. I can see others laughing, but that is the reality. Because when we were talking, everybody's excited, yes. And more so, we even have actually the ambition of eliminating malaria. That is great. Sub-national. It is true, it can be done, and thank you for challenging us that at one point, even Washington, D.C. had malaria, but now it is not there. That really gives us an assurance that even us, we are going to be there one day. Let it be. Allow me to appreciate the fact that the strategies are like when you are in your house, we have put so many measures because you know somebody might come and break your house. You put electric fence, alarm systems, you put CCTV, you decide to also engage the external guards with rapid response and everything. May we also look at malaria as an enemy so that we can be able to invest in all the strategies as we have put together. Thank you so much.
Devolution and sharing of functions between the national and county governments accorded counties an opportunity to focus and address health challenges unique to them. And this is very much apparent and visible in our county. At the time of devolution, we had some of the poorest health indicators with maternal mortality rates of 691 per thousand, live births under 5 mortality rate of 159 per thousand live births. Malaria prevalence rate was at 33, and that was the highest nationally at the time. That one you can't clap. Because it is a sad thing. In addition to the high burden of preventable diseases and emerging non-communicable diseases, our county health system had poor infrastructure, limiting access to quality and responsive services to the people. Malaria was the main cause of illness and death in children under 5, as well as leading cause of poor outcomes of pregnancy in our county. This had to be addressed. Today, as we commemorate World Malaria Day, I can report that we have applied ourselves in addressing the causes of these poor indicators by, number one, investment in primary health care services, with Siaya becoming the first county not only to have 100% coverage of community health volunteers, but also the first county to pay them a monthly stipend of Kenya shillings 3,000, as well as provision of health insurance to our CHVs and their families. They have also become champions in the fight against malaria by testing for malaria at household level and offering treatment for the sick through community case management. And we appreciate the strong support received to this end from Malaria Control Program and our partners, most of whom are here today. Through the various interventions, we have documented a reduction of malaria prevalence from 33 to 27%, while under 5 mortality rate, according to CDC Health Demographic Surveillance Systems, has dropped from 159 to 99 per 1,000 live births. This has largely been due to joint concerted effort by the county government, national government, and our development partners. Borrowing from the Kenya Malaria Strategic Plan, we shall continue with investing in and implementing the tried strategies in malaria control and prevention with preference to integrated vector management. For this, we urge the national government to seriously and urgently consider introduction of indoor residual spraying in Siaya County, in addition to the other vector management strategies. I look forward to greater future partnerships in our quest to having health for all in Siaya County.
It is indeed a great pleasure this morning to preside over the launch of Kenya Malaria Strategy and the Kenya Malaria Monitoring and Evaluation Plan on this momentous day commemorating the World Malaria Day. Malaria remains a disease of public health concern in Kenya, with over 70% of the population at risk of infection. Nationally, malaria prevalence stands at 8%, with Nyanza region having the highest levels at 27%. The coast, a previously highly endemic area, its prevalence has fallen down to 8%, and all other areas within the country at a prevalence rate of 5%. The Kenya Malaria Strategy that we are launching today is the culmination of an elaborate consultative process involving stakeholders at all levels. The new strategy is informed by the findings of the program review undertaken in 2018, the health sector strategic plan, and 3, the Big 4 agenda of universal health coverage. It incorporates global guidance based on our malaria transmission patterns. The goal of this strategy, as stated earlier, is to guide the reduction of illness and death attributed to malaria by 75% by 2023. Malaria prevention will continue to be a key pillar of our strategy. The distribution of long-lasting insecticide-treated nets to communities and indoor residual spraying in high-burden counties has yielded great results in reducing incidence of malaria. Your Excellency, Governor, I take note of your request that IRS should also be extended to Siaya County. Prompt diagnosis and effective malaria treatment ensures that the disease does not progress to life-threatening levels. Currently, over 90% of our public health facilities have the capacity for malaria testing and treatment, I should add. The new strategy will continue with implementation of test before treatment policy while strengthening quality assurance of diagnostics. In recognition of the reducing burden of malaria in most other parts of the country, the Ministry of Health will for the first time establish systems for malaria elimination agenda in 4 counties, namely Kirinyaga, Laikipia, Nyandarua, and Nyeri, as mentioned by Dr. Owako in his presentation. We will work in conjunction with the county leadership, health teams, and the communities to ensure the success of this program. Success in elimination in these counties will be an achievement that will encourage us to move towards elimination in the endemic counties. And even as we move towards an elimination strategy, I think we also need to be cognizant of the fact that we need to have a plan for cross-border transmission of malaria. We are not an island, and we need to consider that as we talk about elimination. The Ministry will continue monitoring malaria trends, respond to disease occurrence with the aim of expanding the number of counties that will be malaria-free. To promote community participation and ownership, the strategy is aligned to the Universal Health Coverage Agenda, which seeks to ensure that all people have access to quality health services they need when and where they need them without additional financial burden. This malaria strategy will require about 62 billion, as we were told, over the next 5 years for full implementation. However, there is a gap in this resource, and this gap will need to be raised from local resources and partner contributions. Let me take this opportunity to re-emphasize the government's commitment to malaria control. The Ministry of Health will provide the leadership for the health sector and continue to work with counties and stakeholders to ensure we achieve our vision of a malaria-free Kenya. I would like to extend our sincere appreciation to the counties for their investment in the health sector. I am happy to note that Siaya, amongst other counties, has included community health volunteers within their budget allocation, thereby ensuring continuity of services at that level. I also note with pleasure that Siaya's budget for health stands at about 31% of their total health. We are also grateful to our partners for the support they have provided in prevention and treatment of malaria, and we urge them to continue supporting sustainable interventions that will translate to better health for all Kenyans. I wish to urge all the stakeholders to participate fully in the implementation of this strategy. The Ministry of Health will be introducing 2 new interventions very soon in the malaria endemic areas. One, as we have heard before, is the malaria vaccine, and plans are underway to get that rolling within the next 2 or so months. The other intervention, which has been lacking thus far but is now part of our strategy and policy, is larval source management, and that too is a program that should be rolled out in the 8 endemic counties before the end of this year. It is my pleasure now to invite all our key partners and stakeholders to join me here on the podium as we formally launch the Kenya Malaria Strategy 2019-2023 and the Kenya Malaria Monitoring and Evaluation Plan 2019-2023. Thank you very much.
Thank you. So can we clap?
Thank you so much. I'll give the CS to say any word about that and really.
Thank you very much. We've now unveiled the 2 documents, the Kenya Malaria Strategy 2019-2023 and the Monitoring and Evaluation Plan 2019-2023. These 2 documents will be used concurrently because one will guide what we are going to do, the other will be interrogating what we are doing. We hope that this will improve our action plan towards malaria. Your Excellency, maybe you want to say one?
Yeah, I also thank you so much for this, and I believe this is not going to be left to gather dust. We will make use of them, and so that we realize the objective for which they have been produced. Asante.